morning.
How
How
are
you?
I'm doing well, thank you. Hey, we're gonna do your first traction session. We are going to be treating you for that osteoarthritis. You've got a little bit of degenerative joint disease, a little bit of degenerative disc disease, and so I think that's the source of some of that numbness and tingling you're having down your leg, and that generalized weakness you're having. We asked you to empty your bladder before we got on the table. I asked you to empty your pockets and remove your belt. We did a quick skin check all the way around to make sure there's no reasons we shouldn't put the belts around your waist. Those reasons for the belts around the waist was I need you to make sure your skin is in good condition because this is going to squeeze you pretty snugly. Two, I want to make sure we don't have any IV lines, we don't have Foley catheters, we don't have osteotomy bags, we don't have PEG lines, insulin possibly, or any sort of jewelry or any reason that this belt would tug on something and be really uncomfortable for you.
Okay.
We took your blood pressure, you're not hypertensive today, which is beautiful. And we did have the conversation about not being claustrophobic.
Yes.
I did a pain rating on a 0 to 10. We did a symptom rating as far as your radiculopathy and how it is peripheralizing. I'm hoping this will help it centralize. And so we're kind of going to keep a symptom journal, you and I, of how you feel before we get on the table. And then I'll give you some post instructions when we get done today.
Okay.
Okay. The table is locked and kind of preset. We've got some pelvic belts. We have some thoracic belts. We have a couple other safety things I'll indicate as we go along here.
Okay.
I am going to have you kind of put your hands on your hips for me because that's an indicator of where I want you to lay on the table.
Okay.
There's a break in the table. In a moment, once we get going, I'm going to turn this knob and you're going to see how this table opens and closes.
Okay.
What I really want in a moment is for those hands on your hips to be right at this break.
Okay.
So as the table opens, it's going to take your pelvis this direction, but your rib cage should stay stationary on the upper aspect of the table.
Gotcha.
I've kind of laid the belts out with just a little bit of overlap because I kind of eyeballed you and saw that our torso isn't very long, and that the top of our hips and the bottom of our ribs are pretty close in spec, okay? I want you to come sit on the table and we're gonna lay back so that those hips are like landing right here for me. And maybe one scoot down. Perfect. Okay. And I'm gonna kind of double this pillow over, which will be a little more comfortable for you. Yeah. We're gonna jump in. It's almost like a jumpsuit. We've got little shoulder straps. And there are some leg straps, but we're not gonna put our legs in them. They're just gonna be on the lateral sides, okay? In a moment, once I get your belts on, we're gonna put something under your legs.
Okay.
Get you more comfy. Okay, so this belt's gonna come around your pelvis. Again, I'm trying to catch the top of your hips. Your belly button is a good landmark for that. I'm gonna move the belt buckles over to one side, which will make it a little easier to cinch our belts up. And then, if you don't mind, bring your arms up. I'm gonna go ahead and place this around our rib cage. Now I'm gonna tell you, these belts need to be snug, but still comfortable. You should be able to take normal breaths. It may feel a little difficult to take a deep breath, okay? But normal breaths should absolutely be fine. Occasionally, depending on what you wear in to clinic, I often have to use a towel across the abdomen, depending on what you're wearing, to kind of give us a little bit of traction. So, you know, if you wore some leggings in maybe that were really slick, And then the other thing is occasionally with a male patient, I'll put an extra layer down, a towel across the abdomen, just to kind of have a barrier between the perineal and the straps and my hands as I'm applying the belts. Okay, so before I tighten the belts, I think I'm gonna go ahead and get your legs up into a more comfortable position. So can you bring your knees towards your chest? And of course I would help you if I needed to. This stool is a little high. There we go. Okay, let me cinch it. Yay, okay. How's that feel? Great, it feels great, doesn't it?
Yeah.
Okay, for your treatment protocol, I really want you in just a really happy neutral spine. And so having your legs up and in a kind of a flexed position is gonna open and gap the vertebral columns through the lumbar spine.
Okay.
Which usually is more comfortable. We can pull patients completely supine, depending on their diagnoses or condition. I'll give an example of, I had a gentleman who went on a ski trip and had a ski accident and kind of went tumbling down. And in the process just had tightness throughout the whole lumbar paravertebral. And for him, putting his legs up into neutral was very uncomfortable. So we just kept him supine. And until all of that posterior chain stretched out, it did give him a stretch along the whole segment, but it didn't over amplify the gapping. The other option is patients that have herniated discs posteriorly, like an L4, L5, HMP. Sometimes the patient gets better symptom relief if we put them on their belly or prone, and then we would strap the belts to them where the buckles are on the kind of the back side of the pelvis, but it's diagnosis specific. Okay. All right. I'm gonna anchor you to the table, and then we're gonna tighten the belts. The anchor is up at the top of the head of the bed, and it's this little jumpsuit I put your arms in a moment ago. You just anchor the patient to the table. This actually is what's gonna keep you from sliding down the table, and is going to create the counter anchor for traction. The machine itself is what's going to pull you. You comfortable?
Yes.
Awesome. Okay. I have a rope. That'll be something else. I'm going to anchor you to the machine here in a moment. We're going to tighten your belts. Here we go. Snug but comfortable. It's okay? Awesome. Okay. I'm gonna set a timer. First session, treatment protocols. I'm gonna keep the timer on me.
Okay.
So that as I wander off, I have a absolute reminder of when I need to come back and check you. And so I just wear the timer around. The machine itself is gonna have a timer as well. All right, last little safety. We actually have a double safety system besides the timer, is a communication tool. This is an automatic cutoff switch. If at any point you really feel like you want this to stop, you have the ability to do that. It will stop the pull, it'll freeze the unit in place, and it'll set an alarm off, okay? And then myself or another faculty member or staff member that hears this alarm go off is gonna come run and see what's happening. So absolutely, if you want it to stop, this is what you'll hit. I'm gonna lay it across your abdomen so we don't accidentally hit it, but it is able for you to reach it.
Okay.
Second is a call system. If you just have a question or a concern, or you're wondering if you should stop it, you just hit the call button and one of us will come running to check on you.
Okay.
So I'm gonna give that to you as well, so you're ready.
Okay.
Your job is to relax. Yeah,
Do that.
allow the stretch to happen. Take some natural, normal breaths while you're on the table. I don't really want you to multitask. I don't want to engage any muscles. The other thing is, you look pretty chill and relaxed right now. But I really wouldn't want you to shift or wiggle or try to move on the table much.
Okay.
So want to make sure if you're comfortable right now, you'll probably be comfortable the whole time.
Okay.
Sounds good?
Sounds good.
All right. I'm gonna grab our triangle bar and I'm going to grab our strap. I'm gonna give you just a tiny little pull down on the table. Perfect. That just kind of slides you into position, and it also tests the security of the belts.
Okay.
We're going to use the triangle bar in place. We're going to hit the release rope button, and we're going to pull the rope out and connect it to our unit. The table currently is at a really good height for her to just simply give us a neutral pull with the rope. I have already programmed the unit to our protocol. I've already asked you your body weight, and I've also looked at our procedure manual to decide which protocol we're pulling off of. And are you ready for takeoff?
I am.
Awesome. Last thing I'm going to do is unlock the table, and I'm going to hit start. All right. So your machine is beeped. I'm going to come in and I'm going to lock the table back into position. How are you feeling?
Better.
Okay.
Stretched out.
I'm going to take your safety items.
Okay.
And I'm going to start to unhook you. I'm going to unhook you from the machine first. And then I'm going to release your belts. But I'm not ready for you to get up yet. So I'm just going to release. Whew, you can breathe.
Ooh, I can.
That's going to help normalize your blood pressure. Keep us from having an episode of orthostatic hypertension. I'm going to release you from the top. And this probably sounds pretty familiar because I'm literally reversing the steps that I did to get you hooked up to the table. All right, I'm gonna bring your legs down and you can just put them on the table. We're moving slow to prevent rebounding pain. We're moving slow to give you a few minutes to just kind of make sure we're not dizzy and our blood pressure is regulated now that our torso isn't so bound. Okay. I tend to not do the belts until the very end because most patients, as soon as you pop the buckles, they're sitting up and ready to go. And I'm not ready for that yet. So the buckles are the last thing I pop. And then we're gonna slip your arms out. Whoop, we caught your jersey. Perfect. Okay, so we're gonna try our hardest to just kind of tighten our belly a little bit, and I want you to log roll like we've taught you. And then come up and let your legs drop off, and we're gonna just make sure you're not dizzy. I'm gonna sit here a moment. So we're gonna track our symptoms. I'm gonna collect a post-pain, post-numbness and tingles, headache, dizziness, blood pressure if we need to. Okay. The way you feel right now will likely change over the next 24 hours. So it's like the volume on the radio. How do your symptoms change? It may take a couple sessions for the duration or the amount of pull to kind of hit your magic number that really gets you some symptom relief.
Okay.
What's going to be helpful for me is for you to maybe keep a pain journal or symptom journal. We know how you felt before you got on the table. We know how you feel now that we're off the table. I want to probably know how you feel at dinner tonight, and I want to know how you feel tomorrow morning. If any of those ratings are concerning to you, you definitely can get a hold of me. Call the clinic or shoot me an email or go into your patient portal. If they seem pretty reasonable, then you can just tell me at the next visit.
Okay.
That's going to help you and I gauge what our next session metrics are going to be.
Understand. Okay.
Also, it's not going to hurt for us to have laid here a few minutes and us to sit here a few minutes, because it helps reduce what's called rebounding pain, which means we gave you a really good stretch, but if we let go too quickly and we start to move things around, the muscles around that area can kind of go into spasm, or just simply reloading the disc, reloading the nerve, sometimes too quickly. Gravity does that. Is going to cause your pain to spike, and then we really have a hard time deciphering if you're not a candidate or we just got up too quick and got some rebound pain.
Gotcha.
Okay. We're going to do another post-skin check around to make sure the belts didn't irritate you, and then I'm going to let you go off to the dressing room, and you can get dressed, put that belt back on, and put your items back in your pocket.
Okie dokie.
Okay.
Sounds good.
Good to go?
Good to go.
Good to go.
Thank you.